So we're going to be demonstrating the big three, which are the three exercises that we usually start, usually within a week of having an ACL reconstruction surgery. The weight-bearing restrictions are different for everybody. In your case, they're going to be full weight-bearing. The weight-bearing restrictions are different for everybody. Okay. So the three exercises we do, the first one is really maintaining the knee in extension. Okay. Because you want to make sure that you have good knee extension when all this is said and done, right? So one of the purposes of having the brace is to make sure this knee is straight. So what you're going to do about 5 to 10 minutes, 2 to 3 times a day, is you're going to work on making sure that the back of the knee can actually touch the table. Okay. Just like we're doing right here. So you're going to slowly let the knee hang backwards, let the back of the knee touch the table, and make sure that this is straight. Okay, you've got that already, and the great thing about having a brace is with the brace you usually get that already. Okay. That's number one. Number two is getting the muscle contraction. You want to sit up here just for a second? And what we typically will do is we'll use the other side as a template. So you're going to put your right hand on your right thigh, left hand on your left thigh. And if you try to make a contraction, you're going to see that it's not going to be working very well because it's been turned off. So you want to turn it back on, because getting this muscle turned on is going to be very important for your recovery. Okay. So what you do is you use a biofeedback method by contracting one side and trying to contract the other one at the same time. By doing both of them at the same time, contract, release, again, 5 to 10 minutes, 2 to 3 times a day. By doing that, it will also help to kind of get that engaged. Okay. All right, so that's exercise number 2. Exercise number 3 is a little bit tricky. And to understand exercise number 3, we have to realize that when you put an ACL in and you contract this muscle here, then you're going to compress this tibia bone in the right way. You're going to compress it. If the leg is hanging over the table and you try to straighten out your leg, then the muscle forces of that quad muscle here are going to actually pull on the ACL graft. That's not good, so we don't want that. Okay. So the third exercise in the big three is going to be getting the knee bent, because ultimately you're going to want that at some point in time. Okay. So what we do here is, rather than just grabbing the knee up, which will pull on the ACL a bit as well too, you're going to learn how to bring the opposite leg under the ankle. So what you want to do is not do what you're just about to do, because our ACL is sitting right in here. And so what you don't want to do is put any forces behind the leg here. So you want to make sure that you or a family member doesn't grab the leg like that underneath the calf. You want to grab it down towards the ankle. So bring this foot down towards the ankle, and then you want to learn to very gently bring it over the side of the table, slowly over the side of a table. Now what you're going to do is come forward just a little bit. Okay. Now you're going to gradually let it relax. Now it's okay to make a muscle to pull this downward. So active bending is okay, but you're going to see when we bring it out the other way, we don't want to do any active extension because of what I mentioned to you. So as you're seeing, you're going to slowly bend it. And our goals for ACL reconstruction are, in week 1, you want to get about 30 degrees, right about what you've gotten. The purpose of going super slow with our program is realizing that the graft is under a lot of biological chaos in the first couple of weeks. And what we see is that if you move it very aggressively in the first few weeks, then you may be changing the environment and you may be altering the biology of how the healing occurs. We don't really know this, but I've found that if you go a little slower, you allow that biology to work, and you don't lose your motion by this program as well too. So you're supposed to be getting 30 degrees in the first week, 60 degrees by week 2, and between weeks 3 and 4 you want to slowly get up to 90 degrees. You're almost at the beginning of week 2, so you can slowly and gradually bring that to 60. Okay. So again, active flexion is okay as you're bending it. Active bending is okay. Active bending is okay because that's actually pulling the leg backwards and is protective of the ACL. Okay. Now when you're done with that, what you're going to find is, instead of just kicking that out, which again you don't want to do, in this position the muscles of the quad are attached to the front of the tibia, and they will actually tug on the ACL if you do that. So you want to use this assisted device right here, your leg, behind the ankle, and gradually bring that exactly. Perfect. And then when you're done with that, so you do that again 5 to 10 minutes, 2 to 3 times a day. That's the third part of the big three. Come down again one more time. Nice and easy. Nice and easy. Nice and easy. Nice and slow. You don't have to do these in a very aggressive way. And that's almost about 40 degrees or so. That's perfect for the first week. You bring that out a little bit. And you're getting it really, really easily. So again, we find that there are 2 different types of issues that we see. Now you can bring that over to the side. One of the issues we see is that person who really gets the motion super easy. That may be someone who's actually taking a little bit of time to heal, and that's a perfect reason why this program is there, to go nice and slow to let the biology set up. Then there are those that are really, really stiff at the beginning. Those people are probably forming a lot of scar. When you're forming a lot of scar, you may be somebody we have to push you a little bit faster. If you can't get those motion criteria that we've just discussed, we'll often start rehab at that time too. With the brace over here, this brace is going to be on for a total of about 4 weeks. And so we use the brace to assist walking. Okay. And depending on what your weight-bearing restrictions are, in your case, we're going to have you put about 50% of your body weight on it. But in many cases, in those that have had meniscus repairs, we'll actually just do what we call toe-touch weight-bearing. So that's something we have to discuss in person. But other than that, the brace stays on an extension for about 4 weeks. And at the end of the 4 weeks, we can progress from there.